Today we're talking about President Joe Biden's prostate cancer diagnosis, but specifically we're talking about should men who are over the age of 75 be getting PSA testing, what type of treatment options are available to somebody who is diagnosed with advanced cancer that has spread to the bones, and we're going to talk to Dr. Mark Scholz. He's a 30-year medical oncologist who is focused solely on prostate cancer, and we're going to hear his perspective. So, former President Joe Biden has been diagnosed with prostate cancer, but the thing about this case that's sad, but also interesting, is that it's not just prostate cancer that is localized, it's, prostate cancer that is already metastasized to the bones. And he is 82 years old, so it brings up a lot of questions. Should we be screening men after 75 years old, even though that's discouraged? How is it not caught? What are his options? There's just so much to unpack here. So, how did you take that diagnosis when you first heard it?
Well, my initial reaction was that there are only two possibilities to explain this phenomenon, because we know that even the bad prostate cancers don't spread quickly enough to allow someone to be checking their PSA annually, which is commonly recommended, and then end up with bone metastasis. That is essentially impossible. So it really only leaves two scenarios. One is that we haven't been given the full story, that he was known to have prostate cancer and they weren't revealing it. Or that some doctor was actually following these foolish guidelines that you stop PSA testing at some specified age. How could such guidelines ever appear? The answer is economical. Sweeping generalizations that are made are basically to save money. And the thinking is that since less than 1% of men over age 75 who get prostate cancer will live long enough for it to spread and cause problems, that we should just not do any PSA testing at all. I, of course, very much disagree with that contention, because letting 1 out of 100 men fall into a ditch makes no sense at all when we have a very inexpensive test to be doing just as part of the annual physical. It is true that it's going to be superfluous and unnecessary in the vast majority of men, but there is a small percentage of men who do have consequential prostate cancers as they get older, and they're going to live long enough for it to become a problem. It is true that we have some fairly good safety nets with testosterone blockade, Orgovyx, and other medicines we've talked about many times on this channel, but those have notable side effects, and you'd much prefer to catch the cancer when it is still confined to the prostate, and where the treatments would not be as dire as if blocking an elderly man's testosterone, possibly for the rest of his life. So there are certainly advantages, in my opinion, to continuing to check PSA as men get older. It's a simple thing to do. It is true that the vast majority of men, it'll be unnecessary, but for a small minority, it will be very consequential, as is so well illustrated with President Biden.
So, it's an interesting thing when we talk about not doing PSA testing for men after 75 years old. What I always thought was odd was your risk for prostate cancer going up goes higher the more you age. And so you're saying these men are going to, age, they're going to have a greater risk of prostate cancer, and we're going to stop testing them. And this is a really sad situation, because these men, like President Biden, find themselves in situations where it could have been caught earlier and in a much controlled setting. Now, a lot of people thought that President Biden had prostate cancer surgery back in 2019. It was actually for BPH, which is a completely different scenario, for a large prostate because of urinary issues. And now we're talking about an untreated prostate that, is now metastasized with this cancer. So what are his options now?
Well, it sort of depends on what the truth is, and we're not 100% sure that we're getting the truth. There have been some very credible, White House physicians, outsiders, who are saying that it doesn't seem plausible that they weren't checking the PSA of the president. But let's take what they're claiming at face value, that he hasn't had his PSA checked for a long time, and now he shows up with metastatic disease, which will be hormone sensitive, because they're not knowing it was present means that he's not been exposed to any anti-cancer therapy. And with the use of testosterone blockade, he should get a very nice remission. The defining issue really depends on two things these days: how many spots of cancer are outside the prostate, and how well does he respond after starting on hormone therapy. Does the PSA march down to less than 0.1 within 4 to 6 months? If there are relatively few spots, we have new scans now, and the radiation therapy technology is so good they can actually sterilize those spots with really no side effects. The combination of hormone treatment plus spot radiation therapy may even allow him to go into a complete remission and the privilege of stopping hormone deprivation sometime down the line, maybe in 12 months. That is very important because his borderline mental status has been talked about quite a bit in the news, and blocking testosterone can exacerbate those problems. The sooner he could get off the hormone blockade and get his testosterone back, the better his mental status is going to function.
Before I get to my next question, I just wanted to remind you that this September we have an in-person prostate cancer patients and caregivers conference. It's a great way to get your questions answered by world-renowned experts in person. You can find out more at PCRI.org. Now don't forget to subscribe to our YouTube channel because it helps support the work we do here in getting these videos out to prostate cancer patients all over the world. And if you would like to support us financially, you can do so at PCRI.org/donate. Now back to my conversation with Dr. Scholz. So, when we talk about men who are older going on hormone therapy, the side effects of hormone therapy, we talk about hot flashes, we talk about weight gain. There's so many that, to varying degrees that men have it. Is he going to have more of an exacerbated effect being an older gentleman who has aged and now being on these hormone therapies? Is it going to be more debilitating for him?
Yes. Of course, we tell patients to try and compensate for the muscle loss and the fatigue by going to the gym. But specifically addressing the mental status issues. Fitness has been the one thing that has been shown to improve memory. And the example I use is a business meeting, say, and meeting some new people for breakfast. At the beginning of the day, someone's introduced to you. It's easy to remember their name. At the end of the day, after getting beat up in the office all day long, you go to a cocktail party and you're meeting new people again, and things are a little bit more of a blur. And the memory, same person, healthy person, refreshed and strong versus sort of beat up and tired, is not going to be able to memorize a name as easily. It can be done, but it's a bigger effort. This is the thing that happens when we block testosterone. Testosterone is a performance hormone, and it affects overall fitness, energy, causes fatigue when testosterone levels are low. And the secondary spillover effect is people complain that their memories aren't as good. And it's not surprising that that would be the case. Well, how much more tragic in someone with pre-existing memory problems that is maybe hovering on the edge of functionality. Now you steal their testosterone and you exacerbate that problem to an even greater degree.
So one of the things about his prostate cancer is that it's Gleason 9 prostate cancer. So a lot of the speculation, and I know you talked a little bit about this before, was really talking about, is Gleason 9, is it possible to metastasize that quickly within, let's say he didn't have PSA testing for a year. He was 81, he got his test, didn't really show much, and now he's 82 and it shows up. Is that really possible as far as that timeline with Gleason 9 prostate cancer?
I think you've nailed the essence of the question and why there's been such an uproar. The answer is it's impossible. I have seen freakish, extremely rare prostate cancers where PSA levels have jumped from normal to, say, 50 within a year. Maybe 3 cases in my career, and I've seen tens of thousands of cases. So they are extremely rare, but none of those patients had extensive, widespread metastatic disease. They did have 1 or 2 spots, but that is completely different than what's being described for President Biden.
So with his prostate cancer spreading to his bones, we're here in 2025. There was a recent study with Aeronote where it showed that if you add a second-generation hormone therapy like Nubeqa to the first generation, there was a 46% decrease with these patients compared to placebo, where you see these patients have not progressed and, it's taking them away from the end result of death, which is exciting. Is this something that we would see, President Biden do? Is he going to probably go on a second-generation hormone therapy right away since it has gone to his bones? Are they going to do chemo? I know you mentioned spot radiation as well.
I think there's a very good chance that he'll be put on a first-generation blocker such as Orgovyx or Lupron, and second-generation agents such as Nubeqa. And of course, they'll track his PSA monthly to see if that goes down to 0. They'll be doing PSMA PET scans to see if the visible metastatic disease is disappearing. In men that only have a couple of metastatic sites, it's becoming more and more routine to radiate those metastatic sites and radiate the prostate. Long-term outcomes are improved. There aren't studies yet to prove it, but in the men that have much more extensive disease and perhaps cancers that are somewhat stubborn that don't disappear completely with hormone therapy, which would be quite common if there were a limited number of metastatic sites and less common if there were multiple metastatic sites. But in the men that have multiple metastatic sites and have most of their cancer go away, One interesting area of research is to add spot radiation to those stubborn areas that are left over. It's not practical to radiate more than 3 or 4 or 5 spots because the radiation side effects start to accumulate after that. But if the combination of the Nubeqa and the Orgovix or the Nubeqa and the Lupron gets the multiplicity of spots that were probably there to start with to pare down to where there's only 3, 4, or 5 that remain active. And a very exciting area of research is to radiate those spots, since it can be done very safely. And you know that you're going after the stubborn areas with a very effective type of treatment. Radiation therapy to metastatic sites can sterilize the tumor in that site essentially with 100% efficacy. The issue, of course, is are there other smaller spots that aren't being seen that are viable, that aren't showing up in the scan that you're not radiating? Going after the large areas would appear to be advantageous, even though studies yet proving that this approach is going to be effective long-term haven't been performed yet.
So would you say the takeaways or the moral of the story from this situation is that men who are over the age of 75 should definitely be getting PSA testing, and that, from what you're talking about, even mentioning the word remission, when it comes to President Biden, that if men are in this situation where maybe their doctor hasn't had them have PSA testing and they're in a situation where they have advanced prostate cancer at the point of diagnosis with it going to the bones, that remission's definitely possible.
Absolutely. The downside, of course, is that there are notable side effects with taking a man's testosterone away when they're more elderly or even when they're younger. That's unfortunate, but certainly justifiable given the known anti-cancer efficacy of these medicines and the danger of just letting the cancer run uninhibited, which will lead to an early demise.
One of the main questions that we get for people in this situation is survival rates. So is there a statistic that you could give us in order to help us understand the possible chance of getting a remission if you are in a state where you're diagnosed with advanced prostate cancer and it has metastasized to the bones?
Well, most people will have a very clear picture into the future once they've been on the appropriate hormone blockade medication for 4 to 6 months. Ideally, the PSA, no matter how high it started out at, may have been 1,000. If that PSA declines down to less than 0.1 within 6 months or so, that identifies a group of people that are going to have very, very good long-term outcomes. And those sorts of outcomes aren't that uncommon. We see all the time where people will come in with PSAs of 50 to 300, and after initiation of appropriate hormone therapy, that their PSAs will decline to undetectable levels. Now, of course, we're also doing follow-up PSMA PET scans to look for any residual activity, even when the PSA goes down to 0 in these patients that started with metastatic disease. We should probably also mention that for someone who's younger and perhaps a little more viable than President Biden is, if there were multiple spots of metastatic prostate cancer, the addition of a few injections of a mild chemotherapy called Taxotere would be considered routine. So we're triangulating on the cancer from multiple different areas using Orgovix or first-generation hormone therapy, Nubeqa or other forms of second-generation hormone therapy, and then Taxotere, which is an effective form of chemotherapy to basically attack the cancer from 3 directions. Studies clearly show that for men who can tolerate the Taxotere, that they will have better 5-year survival rates. It is effective. There is some issues, of course, in taking someone who's already debilitated, elderly. They've already been on hormone therapy, which is going to debilitate them further, and then adding chemotherapy on top of that may not be practical for someone like President Biden. But if he was a younger, more viable President Biden, it would be considered standard.
Our best wishes and prayers go out to President Biden and to his family and friends. This isn't a situation that we would want for anybody, but we do understand that there are a lot of incredible treatments out there in prostate cancer. And so they are going to be able to, as Dr. Scholz said, possibly get a remission. And if you are in this situation, I would encourage you. There are a lot of different treatments. Every prostate cancer is a little bit different. It's important to learn about your specific case and to look at your treatment options. And it is good to know, even in these advanced stages, that there is a lot of options. Now, one may ask, why would you stop PSA testing in older gentlemen, past the age of 75? And I think it's important to remember that when it comes to the prostate cancer industry, there was a huge trend of overtreatment. And what they did is they downgraded the importance of PSA testing, and unfortunately, a lot of men just didn't get it at all, even who should have had it. It isn't that you don't want to know and you shouldn't do PSA screening. It's important that the screening protocol happens. It's actually that you want to know all of your treatment options and not just rush into treatment. A lot of of men were getting random needle biopsies instead of targeted biopsies, and they were treating everybody as a whole, as a general group, and pushing people to surgery. And a lot of people were getting surgery that just didn't need it. So even though we see that it did affect PSA screening protocols, we would encourage you, if you're over the age of 75, please get a PSA test and know, what is your prostate doing? Is there any cancer present? And if there is, there are a lot of options, and it's important to know that ahead of time. So please, if you have friends or family or somebody that is over the age of 75, ask them, what is your PSA? Do you know? It is important to not be caught in a surprise situation, to be able to know what your body is doing, because it is important to take care of yourself and your quality of life as you get older, and PSA testing is a big part of that. Now, if you have, questions about PSA screening, newly diagnosed prostate cancer, or anything when it comes to prostate cancer, actually, you can contact our helpline at pcri.org/helpline. These are prostate cancer patients who have been diagnosed, they've been through treatment, side effects, the whole world of it, and they have a wealth of information for you, and it's just a great resource, and it's all free. So you can go ahead and do that. You can check out our website, also pcri.org. There's a lot of information there, and don't forget to subscribe to our YouTube channel because we come out with new prostate cancer videos every week. Please remember, you're not alone, and I hope you have